Well, as we heard there in Jenny's report, there are calls for opticians to deal with more routine cases. Well, Chris McGahey is from the local optical committee support unit who are working to make eye services more accessible. Chris, first of all, how realistic is this proposal?
We have 12,000 optometrists and we have 7,000 practices in very accessible high street locations across the country. So there is spare capacity there in terms of optometrists and opticians to be able to carry out some of these services.
Are they already doing it to a certain extent?
Yeah, in a number of places across the country, we have a mixture of both monitoring of post-cataract and glaucoma services, and there's about a third of those that are low risk. So these can all be carried out in the community, and around 30 CCGs in England have commissioned minor eye conditions, which again makes optical practices the first port of call for eye-related problems, instead of going to your GP or ending up at A&E.
Why has there been such an increase in eye referrals? Is it just a case of we are an ageing population?
The older we get, the more that we suffer from these eye conditions, and there's been a 30% increase in the number of people being referred to the hospital eye service. In addition to that, obviously rising levels of obesity, rising levels of diabetes are adding to these numbers as well.
Do you think such a scheme would work? Do you think patients may feel somehow cheated they're seeing an optician rather than an eye specialist in a hospital, for example?
Well, I think one of your speakers in the package was actually saying that, nurses give injections. It's a case of having the right professional seeing the patient at the right time. If we can take any pressure off of the health service, be that by having a minor eye conditions, a walk-in service in the local high street, then all of this is going to help save money to the NHS, make it more efficient and more patient-centred as well.
OK, Chris, thanks very much indeed for joining us.
Thank you, Andy.